I'll tell them to put it to that slide na. Pang ilang slide yan? Okay, the Committee on Finance, Subcommittee D, specifically the Department of Health and its attached agency. This hearing is hereby called to order. Good morning, everyone. And my apologies for the frequent changes in schedule. Anyway, I'm sure that gives the people from the regions more time to spend time in Metro Manila. Good morning, and thank you for coming. I'd like to acknowledge the resource persons who are here today, headed by DOH Secretary Janet L. Garin. Good morning, ma'am. Yusek Vicente Belisario Jr. Good morning, sir. Yusek Nemesio Gacco. Where are you? Oh, there. Yes, Ma'am Buntag. Then we have... Well, PhilHealth is represented by Ramon Aristosa. Good morning, sir. POPCOM, Commission on Population, Executive Director Juanito Perez III. Good morning, sir. Philippine Institute for Traditional and Alternative Healthcare, Executive Director Isidro Sia. Good morning, sir. Land Center of the Philippines, Executive Director Luis Dangilan. Good morning, sir. The National Kidney and Transplant Institute, Executive Director Jose Dator.
Sir, good morning, sir.
Yes, good morning. PCMC. Mabuhay kayo. Philippine Children's Medical Center. And Philippine Heart Center, Executive Director Manuel Chuachiaco. Dr. Chuck, good morning. And Dr. Julius Lecciones, good morning. Okay. Can we go to your... Pangilan to? To your presentation. This one, oh. Let me show it.
Slide.
This slide. Do you have, let's go to that slide. Slide number, pakibilang mo para man. 14, 1-4. Yan. Thank you. Okay. First thing that comes out, very obvious, is the last part. General administration and support. The increase is 1,745%. That is big. That is big. And I understand... Where's the detail? Can I see the detail? Can I have it here? Understand most of it is PS. Saan nyo kayo Marisol? Yes. Okay. Andito, no? No. Ano ito? 1 million ito, no? Million yan, no? Noong 2014, yung PS was 190, round off ko na, 193 million. Then, 2015, Madam Secretary, I think I'll have to address this to you, no? In 2014, it's 193 million. PS to, under the General Administration Support, 193. And then, in 2015, bumaba to 142, 143. And then, 2016, biglang nag-zoom into 7 billion, 7.3 billion. Yung ano, titignan nyo, 1,745%. huge increase. Ma'am, explanation, please.
Thank you, Your Honor. The increase of 7.3 billion in so far as general administration and support is concerned actually covers all the new plantilla items that we will be putting on all DOH retained hospitals. Just to give you a background, sir, some of the hospitals are actually operating, let's say, on a well, it's legislated on a 100 bed capacity, but the actual operational bed is, let's say, 250. So the 2016 proposed budget actually covers plantilla positions for the operational capacity of all DOH hospitals. Sa madaling sabi po, by 2016, all DOH retained hospitals should not have any reason in being unable to deliver services to the patients. Kasi kumpleto na po ang staffing pattern yan. There would be
Ma'am, if I may interrupt, you mean to tell me that this is all for this huge 1,000, so this 7 billion increase is all for DOH retained hospitals?
Your Honor, including regional offices, but bulk of it as the new positions, most of them are actually in the DOH retained hospitals, including treatment and rehabilitation centers. Because many of our treatment and rehabilitation centers are actually, I mean, they really lack personnel.
Undermanned, you mean?
Undermanned. And many of our DOH hospitals, let's say they have personnel for a 100-bed hospital, but they're actually operating as a 300-bed hospital. The gap, the health workforce that's needed to allow them to operate to the number of beds that they have now has been filled up by the 2016 budget. So there would be new positions, and the total lump sum for filling up of position out of the 7.7 is actually 4.3.
What do you mean by 4.3?
4.3 billion.
4.3. And the rest would be, I suppose, salary increase?
Yeah.
Kung 4.3, you have 7. So you have 3.7.
Yeah. So, Your Honor, the total staffing standards for all DOH hospitals has a total of 49,952 personnel. The increase in position that's covered by the GA 2016 is 36,098. Part of the
Nakalagay dito kasi yung sa, ma'am, staffing summary, page 194 of the GAA ba to? GAA ba to? Of the GAA, net pala, net. 53,347 number of authorized positions.
Your Honor, that covers DOH hospitals plus the treatment rehabilitation centers.
Yun yung TRCs.
TRCs, yeah.
Narinig ko.
So 36,000 in hospitals. The rest are TRCs. With that increase, Your Honor, the department will also be able to comply with the salary standardization law. So there would actually be an increase in salaries of all health workers under the national government.
Okay. But it's really a huge increase, huh?
Admittedly, yes, Your
yeah.
Honor. It's almost double.
So, itong increase na ito, Madam Secretary, hindi pupunta dito sa doctors to the barrio. Sige lang, tapusin niyo lang. Okay lang.
Your Honor, for the doctors to the barrios and
Let me just read the 1,051 doctors to the barrio plus UHC implementers, then 15,727 nurses, 3,100 midwives, 224 dentists, 308 medical technologies, and 713 public health associates. Hindi pupunta dito.
no, Your Honor, that will actually account for the increase in MOOE because they are not permanent, they're not plantilla positions. Yeah.
Maybe we should. Yes, how about the unfilled positions? Actually, there's a huge amount of unfilled positions in 2015. And paano yun? We're increasing para baka hindi naman ma-filled. Sayang naman.
Yeah. Your Honor, because the filling up of position in 2015 was given in 3 tranches. So we are done with the first trans and the second trans. We have just started for the third trans. But that will be filled up, Your Honor, because these are all ongoing.
Last quarter na tayo ngayon. Huh? So
Yes,
third
yeah.
tranche yun.
Yes, Your Honor. Yes, yung trans, the fourth trans will be in 2016.
Hindi, kung annually, the first tranche na naman for 2016.
Ito po, sir, is quite different because what was done was that all hospitals there was an actual inventory of the volume of patients being catered to, and DBM together with the Department of Health came up with what we call as the total staffing standards. The required health worker to patient ratio. From that, it was divided into 4. So there's the first trans, the second trans, the third trans, and the fourth trans. It's not based on calendar year, but it's actually based on transes of release. But the 4 transes is supposed to fill up the total staffing standards.
So this one is the ratio called, what did you call the ratio? The DBM?
Total staffing standards.
Total staffing standards. And DBM and DOH agreed on this recently.
Yes, Your Honor.
Last year, I suppose,
Yes, Your
2014.
2013, Your Honor.
2013 pa. So, facing ang implementation ito.
Yes, Your Honor. There were some, during the implementation, meron po kasing nangyari na andyan yung trans 1, but then it was not being filled up yet. So what DBM and DOH did was to come up with timelines that if you're not going to fill it up, there was like mandatory filling up of positions. So the hospital cannot wait; it should be filled up already because there are also a lot of applicants from the outside. So applications was not limited to those who are already inside the hospital.
So there will be no vacancies, there will be no unfilled positions after the last phase.
Yes, Your Honor. Because what was done is if we will not be able to fill up trans 1, we won't release trans 2.
I see.
And na-delay po yung iba kasi yung hindi pa na, parang walang timelines binigay trans 1, so hihintayin mong matapos.
Who monitors whether it's fully filled? DBM?
DBM and our HR, Your Honor.
Okay.
And we have set timelines already. So, meron siyang, kumbaga, they monitor all hospitals as to the percentage of filled-up positions.
Okay. So let's talk about this, well, doctors to the barrio, that's quite clear, no? These doctors to the barrio, they augment the local, if there is any, the local doctors, if there are any. Am I correct?
Yes, Your Honor. And they are actually placed also in GIDA areas.
GIDA, yes.
And for municipalities who are fourth, fifth, or especially sixth-class municipalities who cannot afford to hire a doctor.
Who cannot afford. So really, this is just the national government supporting local governments that are not very affluent.
Yeah. Yes, Your
Fourth
Honor.
class, fifth class, sixth
It's
class.
also a pool of doctors wherein, let's say, because most of the rural health units are manned by a single doctor. If the doctor goes on study leave, or if they go on sick leave, or any untoward events that warrants the absence of a doctor in that locality, there's an immediate replacement from our DTTB pool.
Okay, okay. But this pool, these are already deployed all around the country. In other words, we don't have doctors sitting in a room in the DOH waiting for, no, they're deployed all over.
They're all deployed, Your Honor.
Okay, okay. Nurses pretty clear, midwives pretty clear, dentists, med tech, public health associates. You're going to have 713. Ano po itong public health associates?
Your Honor, the Public Health Association is actually a takeoff from the program called Community Health Teams, or CHTs. When we did a review of the outcome vis-a-vis the investment of the government on CHTs, we realized that there was a gap in terms of leadership and knowledge-based gathering of data. Public Health Associates, by the QS that we have crafted, actually refers to graduates of a 4-year medically related course. They have lower salaries than the nurses deployed in the areas, but they are actually there to man not only the barangay health workers, but to also help in immunization, to give us the data to monitor and supervise DOH programs. Most of the public health associates that we have, Your Honor, are actually nursing graduates. The beauty of this is that they complement the NDPs. The NDPs are licensed nurses who unfortunately after 2 years would sometimes seek greener pastures abroad or would have themselves employed in the private hospitals. There's a high turnover. The public health associates usually stays. Many of them, and employment-wise, this was actually able to accommodate the 60% who does not pass the nursing board exams, but are equipped with the knowledge on healthcare.
You mean ito yung ano, so, kasi tama nga naman, sinabi mo, for college, what did you say?
For 4 years, medically related course. But
4 years medical related course. So basta graduate ka ng 4 years, and usually, tama nga naman, right along their alley, these are people who finished nursing but have not passed. So doon sila mahuhulog sa tinatawag na public health associates.
Yes, Your Honor. Kasi sayang po yung pinag-aralan nila, and sometimes they would end up doing things na hindi naman related sa healthcare delivery. But having employed them, we have realized that because they're lodged in the regional offices, but they're actually sent to the rural areas. Ang dali po ng cascade ng DOH programs because they understand the structure of the Department of Health. They also understand universal health care. And the trainings and seminars invested by the department on them, there's continuity kasi hindi po malakas ang turnover, ay hindi po mabilis ang turnover.
Oh, dahil hindi, yung greener pastures, hindi sila pasado sa... Pero bakit 713? Anong basis mo, nyo, ng department for just 713? If that's the case, no, if that's the role, and considering that they're the, shall we call them, parang replacement sa CHTs, di ba?
They would be the leaders of the community health teams. In other words, the barangay health workers who are there, instead of just seeking guidance from whoever they hear from, or from hearing some misinformation over the radio or whatever, they would be guided by the public health associates.
Paano ang interplay nila, interrelation nila with the MHOs?
They report to they report directly to the regional office every 50th and 30th of the month, complete with a report. Meron po kaming binibigay na parang matrix on what they're going to fill up in terms of data every quarter. Pero they report directly to the MHOs on a daily basis. Parang umiikot, they're like door reps. So the 685 were actually sent to focused geographical areas. These are the municipalities wherein our data does not speak a lot. Kasi minsan meron tayong immunization program. And then we send the vaccines, we send the teams, but because it's a devolved system, we have a difficulty in assessing ilang porsyento na po ba talaga ang nabakunahan. So they're there to get the exact numbers and at the same time to guide the LGUs. It's closing in on the gap between the central office and the devolved healthcare. They also help in immunization activities. They help in mother care. Tapos yung mga others who have a lot of questions about PhilHealth. So they are advocates.
So they are number one monitors of the Department of Health.
Yes, Your Honor.
Number two, they are fountains of information of DOH programs. Number three, they monitor, give information. They don't supervise anything. They don't make mando.
No, Your Honor.
They don't, no?
No, Your Honor. But they have a graph. It's like a table that many of the programs would give them every now and then that they would fill up. It will be a data that will be incorporated into the central office for us to be guided in terms of policy directions.
So they are also data gatherers.
Yes, Your Honor.
So we have, first role is fountains of information. Second, data gatherers. And third, ano po yung pangatlo?
Yung monitoring.
Monitoring, yes,
Yeah.
monitoring. Tatlo.
Because, Your Honor, what was being done before, with exactly the same amount being used, the data was being taken from barangay health workers. Well, they are very active and they really go around, they go from one house to another house. There's usually a disconnect between medical knowledge kasi ang naisusulat na iiba based on a different understanding. But for the public health associates, since they're graduates of the Bachelor of Science in Nursing, naiintindihan po nila how to collate data, where to put which one, how to interpret it. If you say about adolescent, ito talagang definition nila ng adolescent. If you say teenage pregnancy, if you say adverse effects, in other words, Your Honor, they are starting to pave way for a more reliable data that the central office can gather and that will now guide us. Let's say yung ibang, kung kailangan namin malaman, ano ba yung mga data na nasa baba? Let's say if we talk about cancer, we talk about hypertension, we talk about diabetes, these are actually the pool of newly hired DOH personnel who are getting that for us. And then we compare that with what the LGUs are submitting.
Okay. Okay. Importante pa naman yung data for health, no? Because
Yes,
that's the
Your
basis for everything. The basis for everything.
Yes. And they're also actually supervising, example, we have the End Polio campaign. So sila po yung nasa baba na nagtatanong at iniikot. Tinitingnan nila wala na ba talagang polio or meron bang nagde-develop ng symptoms na baka simula ito. So they monitor
It's not supervising, it's monitoring.
Monitoring,
Ah.
monitoring. It's still monitoring.
Because I'm also interested if there's in case of conflict between them and the MHO. Pero wala because
You know, you're
MHO supervises, sila monitor lang.
monitor.
Yun naman itong, ano ba itong, before we leave the Public Health Associates, pilot pa lang ito? O ito
We started that this year, Your Honor, by getting some of the funds.
yeah, but you
for
plan
payment.
to increase them because 713 lang eh.
Yes, because initially there were only 12 per region. So mas konti pa. This is already an increase of what we have. We used to have 192 for 2015.
Do you plan to increase this
Yes, the proposal for-
2017?
We'll play it by
Reverse. You
we'll
haven't gone
assess.
that far yet. Yeah,
Yes. There's a huge, there's actually more than an increase in 320% for 2016, from
Okay.
192 to
okay. Malaki na
700.
palang increase, 320%.
Yes, Your Honor.
How about itong, let's go to this UHC, implementers.
Your Honor, they are actually the universal healthcare implementers. If we look at the qualification standards, they are graduates of the Doctor of Medicine. Some
Okay.
they're doctors actually.
They're doctors. And what is their job description?
The reason that we crafted the universal healthcare implementers, Your Honor, because we noticed in many of the LGUs, once there's a conflict between the career municipal health officer or city health officer or even the provincial health officer with the local government chief executive, then healthcare is being sacrificed.
Because?
Because of usually political misunderstanding. Let's say, yeah.
Okay.
Kasi devolve siya, yung nag-employ ng doctor before was, let's say, the former mayor or the former governor, then natalo, iba na yung umupo, nagkakaroon ng allegation ng politika. Ang problema po doon, Your Honor,
Which is very common given our local political settings, yes.
it's very common. So, nawawalan, ang nasasakripisyo po doon, healthcare eh. Yeah. Then sometimes there would be, may mga duda na magdududa yung governor or yung mayor na tatakbo for a political position yung doctor. So parang they're being frozen on one side. And they are not being allowed to be productive.
So ang sasalo nito, itong ganitong sitwasyon, yung universal healthcare implementor.
Yes, Your Honor. This is actually a pool of doctors na kunyari hindi siya makagalaw-galaw doon, but then they have been trained by the Department of Health in many of our programs, then we will absorb them as one of the universal healthcare implementers, hire them, and put them on another area na walang doktor. In other words, they will be able to allow the implementation of DOH policies and programs up to the grassroots level, but at the same time, they will be allowed to integrate the local health systems.
And these people are not plantilla? All these people are plantilla or non-plantilla?
We are non-plantilla, Your Honor, because of the law on devolution.
Sa DOH, they're not plantilla.
Not plantilla, Your Honor.
So they're contractual.
Yes, that's why their budget is under MOOE. However, we computed they will be getting the salary similar to the doctors to the barrios, and they will also be, that will be augmented much by PhilHealth professional fee reimbursement.
So what's the sustainability of this? So every year we have to just fund it. It's
Yes, Your Honor. We looked at the sustainability and look at the projections of the sin tax revenues. Sa sin tax kasi nakasaad naman talaga doon yung hiring of medical
80-20
personnel.
ratio.
Yes, so hindi po siya nag-exceed. In other words, it's sustainable because the sin tax revenues allows it to be.
So you source it from the sin tax.
Yes, Your Honor. Sa iba po, there are like very small municipalities na meron silang mga isla-isla. We also cannot hire doctors there. So it will be the it will be the national government hiring the doctors on a contractual, on a job order basis, but being assigned. This is to close the gaps on the implementation of many of our health programs.
Ito naman, let's move on to this itong early child care development. Kasi yung National Nutrition Council, are they here? National Nutrition Council. Anyway, yeah. You have a 64% increase, 65% increase in your budget, no? For the National Nutrition Council. And it's attributed to this program called the, what do they call it again? Yeah. Yeah, for the first 1,000 days intervention. Can I have an idea of what this is all about? Is it mandated by law, or is this just a policy program that DOH?
It's an Early Years Act that calls for an integrated delivery of services for health, nutrition, and social services and early learning. Based on an assessment of the agencies involved in the Council of ECCD, the biggest gap is on services in the first 1,000 days, meaning pregnancy up to the first 2 years of life.
Yes.
So this is an attempt to deliver integrated services from pregnancy, which means the Department of Health and the LGUs. But the biggest thing that we saw as a gap was the lack of promotion of infant and young child feeding, which becomes a cause of stunting of children early in life, which has significant implications.
What's
early.
the term, ma'am?
Stunting
No,
children.
no. The cause for the stunting, the feeding, what kind
Infant and young child feeding. So that's breastfeeding. Breastfeeding, there's a lot of initiatives, but on enabling mothers to give the right food at the 6th month of life onward, that's a big gap. Now, we don't actually give food, but you would capacitate mothers to make the right decisions in choosing food.
Capacitate meaning inform.
Inform, plus merong working with the Department of Agriculture to enable mothers to have community home kitchen gardens together with a community kitchen garden para meron ding source of food. So yun yung input natin for the program.
Do you have metrics so that you can measure your...
Yes, sir. The whole, well, it's initially the division is a three-year effort. So
and it starts this year?
Next
2016 pala?
There are provisions for an endline, baseline endline, and midline for process monitoring, so that we can determine if it would really make a difference, and we can scale up in other municipalities.
So you do have the metrics?
There are metrics. There are clear indicators. Now we just have to get the institution that will do the baseline and endline.
Okay. And it's the...
And the other thing, sir, is there's stronger working with early learning. Early learning, so that even in the first 2 years of life, the child is exposed to psychosocial stimulation that has been proven to have better effects on, parang if you have nutrition, health, and psychosocial stimulation, you have a better output in terms of the development of the child. So it's not just DOH or NNC, but it's really the different organizations, including the SWD. The idea is also that when they reach the 3 years, 4 years, 5 years, they'll be more school ready because they've been given the proper foundation in the first 2 years of life.
So 1 billion will be 1.9 billion will be lodged in.
No.
For this purpose. There is a DBM document that says there will be 1.9 billion. Madam Secretary, it says 1.9 billion will be entrusted to the DOH OSEC for the ECCD.
Your Honor, it's actually an attribution of existing programs for ECCD. It includes immunization. The total that we have is 378.321,314 million. Because this is the budget for the 10 poorest provinces. But if we look at all the provinces, then the figure that you gave us actually coincides for the ECCD investment lodged in the Department of Health. This includes immunization, iron supplementation for low birth weight infants, vitamin A supplementation, iron supplementation for lactating women, the supplemental immunization in measles, multiple micronutrient and vitamin A supplementation, deworming.
Ito yun, ano?
Yes.
Ito po yun. Apparently, this one of your slides.
Yes, Your Honor.
Yes,
That's
yes.
a total of 378.321 for the 10 poorest provinces. But in the regular programs, there's a corresponding amount lodged there for the remaining 70 provinces. That's why it's a total of more than $1 billion.
Okay. Okay. So maliwanag po, Miss Lourdes Vega, ma'am, you do have metrics, ha?
Yes po.
Sayang naman
That
kasi
was-
kung...
No po, that was, I think, purposively integrated in the way the things were formulated.
And this is for the whole country na?
Initially in the municipalities covered by the Accelerated and Sustainable ASAP. Yung
ASAP.
Doon
Yes,
muna,
yes.
doon
Under
muna.
the National Anti-Poverty
yes po.
Commission.
Doon muna para you have now opportunities for better incomes, and then you have better services that would complement each other.
And that would be
Ganun
prudent
yun.
since it's a start program,
Yes.
so you can see where you go wrong, where you can improve, and all that. Yes, very good, very good. Okay, let's go to the other one. Why is there, Madam Secretary, yung Health Sector Regulation Service, during the last hearings on my PhilHealth, tinanong ko si Attorney Lutero, and he said that yung budget niya kulang. Tapos tinanong ko siya, sabi ko, mag-submit siya. Sige nga, kung kulang, di sige, mag-submit, mag-usap tayo ng budget, mag-submit ka ng budget. To my surprise, this morning, I was informed, hindi pa nagsasubmit po ng budget. What do you call the unit of Dr. Lutero, Attorney Lutero,
Health Facilities and Services Regulatory Bureau. Health Facilities and Services Regulatory Bureau.
yes, Health Facilities
And Services Regulatory Bureau.
and Services Regulatory Bureau. Okay.
Your Honor,
And is it true naman, so question number 1, bakit hindi pa na-submit? And question number 2 is, nabawasan yung budget niya, itong bureau, this year, for next year. Totoo ba? So first question. Yun, I was wondering bakit medyo...
Yeah. Your Honor, yes, there's a slight decrease. For 2015, the total budget of the Health Facilities and Services Regulatory Bureau is 48,899,000. The proposed 2016 is 43,666,000.
So there has been a decrease in that bureau. But
Yes,
I'm
Your
also
Honor.
talking pala of health sector regulation services.
Yeah, Your Honor, I will come to that.
Oo.
Yes. But for the...
Bumaba din eh.
Yes, actually, I just conferred with DBM and our finance team, and when we recomputed, hindi siya actually bumaba. Instead, lumaki pa. I'll come to that, Your Honor, but let me first answer the Health Facilities Services and Regulatory Bureau. There's a reduction in more or less around 5 million comparing 2015 and 2016 budget. The reason for this is that some of the job orders were actually classified under PS.
Sandali. Secretary. Yung unang tanong, nasaan na yung budget na dapat na-submit sa akin at hindi na-submit?
Yeah. Your Honor, it's with me now. My apologies. I actually did not sign it yet, so that was the reason why it was not submitted by the department. But Director Lutero actually submitted it to us. The reason, Your Honor, is why I did not submit it, because I wanted to confer with DBM, with the EXECOM members, and with our policy group. There's a request for an increase for an almost double budget. However, Your Honor, when we assessed the outputs of the Health Facilities and Services Regulatory Bureau, yung po kasing, especially in terms of licensing, like for the birthing clinics, which are actually small birthing clinics in the provinces, it takes around 5 to 8 months for a license to be released. For the hospitals, matagal rin. And when we reviewed the situation, what we are seeing as a gap is that it's very much centralized. The renewal of licenses are actually being conducted by the regional offices. Hence, after conferring with some of the regional directors, we were told that if we just decentralize the issuance of license to operates and other permits, it will not only be faster, it will be more efficient. And that is the reason why I did not sign this. Kasi kung nag-a-apply ka tapos you're a midwife, meron kang birthing clinic na maliit, you have to come to Manila paulit-ulit para mag-apply ng permit. Where if you decentralize it at the level of the regional directors, it will be more efficient, it will be faster, and they know the terrain better.
Ma'am, you said the initial license is issued by the Bureau here in the head office.
Yes, Your Honor.
And then subsequently, you need I suppose, an annual renewal, right? Whatever period of time, you need a renewal at some point in time.
Yes, Your Honor. It's
And the renewal is given by the regional.
Yes, Your Honor.
And then, it does make sense to bring it down to the regional, the initial operating license to operate. Do you have your regional directors here? Are they all around?
Yes, Your Honor.
I don't know if they agree or do you object? Not really. They know the situation, they're closer to the ground, and that reduces the red tape and the time for the approval or disapproval, whatever it is, no? I think that really makes sense, Madam Secretary.
Thank you, Your Honor. We have actually crafted the guidelines already on decentralizing. In fact, I was able to sign the draft, but of course we're getting the clearance from the Health Facilities and Services Bureau.
I don't understand. You're getting the clearance?
Just for purposes of having the initials placed on the new guidelines, Your Honor.
But why the word clearance? Do they have the authority to?
It's just so there's a proper consultative process, Your Honor. But after that, I'll have to confer with the EXICOM and the regional directors.
So why not, Madam Secretary, devolving all the functions of the Health Facilities and Services Bureau to the regional? Why not everything na lang instead of just the licenses?
We will look into that, Your Honor, although the central office, specifically the Bureau, the Health Facilities and Services Regulatory Bureau, would actually comes up with the requirements, the licensure requirements. So sila po yun. They can, kasi marami rin po yung constantly tinitingnan, constantly nire-examine, and then we also have a lot of complaints in terms of compliance that can actually be the focus of the central office, specifically the health facilities and services.
Maybe the central office can be a parang oversight and then give it, kasi there should also be checks and balances, hindi ba?
Yes, Your Honor.
I'm reminded now of the PhilHealth, yung inano natin sa PhilHealth na hiniring natin tungkol sa eye centers, di ba? Ang nakatuklas doon, yung internal audit ng PhilHealth eh. So yes, my thinking is let's devolve everything as far as health services and facilities, licensing, standards, permits, no? But the standards, of course, are given by the head office, no? And then an oversight just to monitor also. Otherwise, there's no check and balance. What do you think of that, Madam Secretary?
Your Honor, that's a very good suggestion. We will discuss that immediately after the deliberation of the budget. And we do agree that's actually a very good suggestion. The licenses to be issued by the regional offices, therefore it's faster, especially on the private sector because they are investors. But the central office, specifically the Health Facilities and Services Regulatory Bureau, will continue on monitoring, supervising, setting the standards, and seeing to it that all hospitals are compliant.
You know, in correlation to that, I was thinking, once universal health care is achieved, health coverage is achieved, what would be the role of DOH? What would be the role of DOH?
Your Honor, yes, it's quite difficult to attain universal health care, but it's more difficult to make it sustainable. So one of the biggest roles that the department will be playing is to make it sustainable, and that's coming up with programs, coming up with areas wherein subsidy, mentoring is needed, the need for personnel, coining everything, infrastructure, personnel, and sustainability.
Yes, but assuming there is universal health coverage already, assuming, what would DOH, would not DOH role be more on this, on making sure that there is proper standards for the institutions, for the licensing of institutions, and for the services that are provided?
Yes, Your Honor, we agree.
And so, PhilHealth's role will therefore be more of standards na lang, and making sure that the standards are met by the suppliers of the services. PhilHealth naman takes care of payment of the services.
Yes, that can be looked into, Your Honor. And well, that will be on the aspect more on the curative care. DOH can now start and shift to really preventive care, standards, policies, and even proposed legislations.
And also defining the range of services of each unit. For example, you have barangay health stations, RHUs, district hospitals, and then provincial hospitals. And then at the end is regional medical centers. So it starts with BHS. So you just define the range of services of each unit.
Yes, Your Honor.
So that you can say na, oh, if it's BHS, ito yung range of services. Kung ito ang range of services ninyo, let's say, for example lang, so hindi nyo kailangan ng x-ray dito.
Oh, yeah.
Dito sa district hospital, dahil yung sa range of services nyo, dito ang kailangan yung x-ray, ganon.
Yeah. Because they should not compete with each other. They should instead complement.
Complement each other. And that's, I think that would be your role as a Department of Health. Standards and equipment, definition of services, licensing of institutions for the private.
Yes, Your Honor. In fact, we've started with the mapping on that. So yung iba ngayon na nagre-request, let's say they want a CT scan, dinidisapprove namin kasi there's a hospital 20 minutes away na meron na naman.
And what do you think of the idea of DOH totally getting away from being a service provider na lang? Yung mga hospitals, specialty hospitals, gawin na lang natin GOCCs. Yung mga medical centers, gawin na natin GOCCs. Doon na kayo mag-focus sa definition of services, standards, licensing. PhilHealth takes care of payment of the services.
Your Honor, on the conversion of the hospitals to GOCCs, kasi yan nga ngayon yung medyo, because we're being requested and repeatedly asked about, do we convert all hospitals into GOCCs? I believe what was sacrificed was the patients, especially the ratio of service patients. Because we're in fact, by law, there should be only 10% pay patients, but of course we have already been flexible because not, parang yung 90-10, 90% service, 10% pay, that's the rule. But then it has shifted to 60-40, that's the most acceptable, 40% pay, 60% service. But in the existing GOCCs that we have, well, except for Philippine Children's Medical Center, the patient ratio is 80 to 90% pay, 10 to 20% service. Which now runs in contrast to the real intent of healthcare delivery. And moreover, Your Honor, there were actually loans incurred by the corporations, which was not exactly entwined into their financial capability of repaying those loans, where it should be invested, how it should be invested, and in terms of management. Kumbaga, the GOCC should have been a standalone, that the intention was to allow it to earn, to allow it to incur loans, but to allow it to deliver service, and at the same time, getting less subsidy from the government. On the other hand, there is this issue of service delivery to the patients, which we have seen by the documents that we have reviewing has actually been sacrificed. Parang nahihirapan sila because they still need the full support in terms of government subsidy, pero nagiging mahal yung rates. And in terms of benefits, let's say that PCSO, the Presidential Social Fund, the Medical Assistance Program can actually give to these GOCC hospitals, nalilimit din siya kasi konti rin yung kanilang service patients.
So what you're saying, Madam Secretary, is the DOH should not convert everything to GOCCs, because if you convert them to GOCCs, then the patient, the pay ratio suffers?
Yes, Your Honor.
Okay.
Many of the beds for service patients have actually been sacrificed for private patients.
Well, I'm not talking about privatization. No? I'm just talking of converting them into GOCCs. Para sa ganun, there's this idea so that DOH can just focus on standards for services and standards for institutions, standards for equipment, and making sure you're basically parang you're the WHO in the country, and that's it. And then parang clear ang roles ba?
It can actually be done, Your Honor, siguro on a different scenario. Let's say it will be a GOCC, but then there should be parameters by which they will operate. Example, if it's a GOCC, then it should operate as a government hospital. So the patient ratio should not be sacrificed.
The parameters should be there in the charter. The patient ratio should be written into the charter.
And who will police? Who does the oversight powers? Because while Congress and Senate has the powers over this, andun din yung question on sustainability. So what can actually, our proposal, I mean, and then just thinking out of the box is that if the government will be giving this hospital a subsidy, it will not be direct subsidy if they're a corporate. It will instead be a subsidy to patients that the patients can use to avail of services in that hospital. Example, Hospital A. Kung ang kailangan niya na subsidy is 300 million, the 300 million will not be given direct to the hospital. It will be given instead, let's say, to the Department of Social Welfare and Development.
But, ma'am, but that's already presuming there's universal health coverage, so PhilHealth takes care of everything.
There is still, Your Honor, an out-of-pocket expense.
Out-of-pocket expense?
Yes. Example, kung the aftercare, the rehab care, the maintenance medications, the check-ups, yung laboratories na pabalik-balik nila. In other words, if the subsidy, let's say, is 300 million, you instead give it to an agency that will give that amount. It's like, it's a subsidy earmarked for this hospital, but being coursed through patient utilization. Para pagka pumupunta yung pasyente sa hospital, i-welcome ng hospital because they have the power of the purse. And they will not be outrightly refused.
Okay, I can see that this can be ripe for another set of hearings, no? Because it seems very interesting. But basically, if you say that it should be, if the parameters are there, then you are not you will not object to that as long as the safeguards that you said.
Yes, Your Honor. And one of the things that actually the department is now looking into is the procurement aspect. Kasi pag isa-isa yung hospital, they don't have the economies of scale. So we're now, we have an area we have an office in the department. It's the National Center for Pharmaceutical Access. Tinitingnan nila ngayon, example, IV fluids. Magkano ba sa Hospital A? We compare it among DOH hospitals. DOH lang. Mas iba pa yung sa LGU. Mas mahal ang bili nila kasi mas konti ang volume. Now, iba-ibang hospital, iba-iba din yung procurement price kasi hindi nakaka-access ng isa doon sa direct supplier. So that's also, because that will actually maximize PhilHealth benefit. Kasi kung mas mura yung iyong mga gamot at mura yung iyong supplies, mas marami ang makukover ng PhilHealth, mas konti yung out-of-pocket expenditure. So if we allow them to exist as one corporation each, meron kanya-kanyang presyo, meron kanya-kanyang procurement, minsan napapamahal kasi konti lang kailangan.
Yeah, that's one disadvantage of that model that we're thinking of. But you know, kasi one it is to clarify the roles of the Department of Health. Wala na yung sakit ng ulo na yan. I'll call it sakit ng ulo. But anyway, what you said also makes sense, yes.
Your Honor, what we also notice is the aspect on financial management because it should, where we could not sacrifice healthcare delivery. We also have GOCCs, corporations, na dapat merong business mind yung nagmamanage. Because it has something to do, let's say, if we're talking about, let's say, PhilHealth, it's also GOCC.
That goes into the appointment of who should be running the hospitals and the board, if there should be a board of the trustees of the hospital.
Yes, Your Honor. That's why there are actually many thoughts that's coming to us. We have started with a group looking into how this can be resolved. Kung kinakailangan ba ng subsidy, paano? Or baka kasi sa dami ng birokrasya ng government, it can be a government hospital but privately managed, but the private group that will manage it will only get, let's say, a 5% management fee. But you have parameters that dapat ito yung iyong profile ng pasyente. We can actually discuss, Your Honor, the the hospital system that the government can enter into.
Because what I see kasi is the DOH is sets the standards for the services, for the institutions, for the equipment, purchases drugs. It's so so many functions, but
Yeah.
I think it might be better if we simplify the equation and clarify the role of DOH, so that all the rest should be made by the hospitals themselves, and DOH just focuses on definition of the range of services, standards. But anyway, I can see that this can
Yeah, we'll look into that.
when we can have some more hearings on that matter.
Your Honor, on the second question, why the decrease in the allocation for...
The health sector regulation services.
Yeah. I've traced, and it's not actually a decrease, because apologies for that, Your Honor, our mistake. It's a mistake of the Department of Health in the preparation. What we reflected is that which is reflected in the General Appropriations Act. However, in the special provisions, there's an automatic appropriation specifically for FDA and BOQ. Ibig sabihin, it appears na nawala siya, pero dun sa automatic, dun sa special provisions, the income that they earn, actually goes back to them. There's full retention of the earned income. So example, for FDA, the income for July 2014 to June 2015 is 366.867 million. So that should have been added kasi yan po ang ceiling na linagay as part of the automatic appropriation. For the Bureau of Quarantine, it's 180 million MOE for 2016 as a projected revenue for that year. The revenue for 2015, this is projected also is 112 million, but the actual revenue in 2014 is more or less 140 million.
So it's basically what you're saying is because there are
Automatic retention of
retention.
income. So what is now reflected in the FDA and the Bureau of Quarantine budget is only the personnel salary, PS lang po. Natanggal yung MOE and capital outlay because of the automatic retention of income. So the total amount that has been remitted to the Bureau of Treasury by FDA pending utilization has now approached 1.5 billion. That's why we're now in the it's subject to release, only that FDA has to come up with a good business plan that will allow it to sustain its operation. And Your Honor, we have a consultant already looked into the fees. We're wrapping it up, and more or less probably in 2 weeks' time we'll be able to publish it.
Okay. 1 minute suspension of the hearing.
Your Honor, if I may, I apologize, I stand corrected. It's not automatic retention. The automatic retention is for all the hospitals. For FDA and BOQ, it's automatic appropriation. It's still the same. They can use the money, but you just request it from DBM every time you need it.
Automatic appropriation?
Yes, Your Honor. In other words, kung magkano po yung kikitain niya, yan po yung kanyang appropriation for MOE, but they remit it and then DBM issues the SARO. So that expenditures can still be guided and over.
Yeah, because appropriation means it has to pass the Congress, hindi ba? Now, if it's automatic, that means it doesn't have to pass through Congress.
Yes, so nakalagay siya doon as automatic appropriation.
Okay, okay.
Yeah, pursuant to the law that was passed, the FDA Act.
Okay,
Yeah.
okay, okay. Okay, let's go to okay. Let's talk about that 7.3 billion for PS. Do you have a deployment plan?
Yes, Your Honor.
How will it go? Since 2014, I understand, no?
Yes, Your Honor. The deployment. Your Honor, the deployment plan for the Plantilla positions.
47.3 billion. PS 7.3, yeah.
We're with your indulgence, Your Honor. We're just getting a copy of transfer.
Okay then, hearing suspended for 1 minute. hearing resumed. Secretary, Madam Secretary, ganito po yun, ano? Ganito po yun. Ito yung statistics, no? I wonder, can we show this on the, no? Wala, no? There's no slides. Just look at this, no? This is from the map, ha? In 2014, the total number of authorized position, okay, is 43,000. 43,551. Round up to 43,000. And your budget was 192 million. 192 million for 43,000. Hindi, yun ang field. Yun ang field. Actual nga pala, no? Hindi, ganito. 27, number of field positions is 27,000 for 2014. Ang binayaran nyo, 192 million. Under PS. This is the, Office of the Secretary, first page.
Yes, Your Honor.
Okay, kita mo?
Yeah. But
Okay.
I think the 192,
Let me just finish
Yeah.
now. So, in 2014, 192 million for 27,000 positions. And then, sa 2015, you have 142 million, bumaba pa, for 31,000 positions. Okay? Suddenly, you have for 31,000 positions in 2016, 31,000, you have 7 billion.
yes, Your Honor. Just to explain,
31,000, you needed 142 million. 31,000. Now you have 31,000 pa rin, but now you need 7 billion.
yes, Your Honor. Actually, what was happening before 2014 and 2015, the salaries of, the allocation was contained in a budget called the Miscellaneous Personnel Benefit Fund, lodged in the Department of Budget and Management. So that was now extracted and transferred to the DOH, as well as to other government agencies. That covers for the 4.3 billion. The increase, yung dito po, Your Honor, yung 53,347, yung authorized positions, that's the authorized positions as of 2015. Hindi po dyan nasama yung 7,438 newly created positions that will be funded by the 3 billion. So, kasi hindi pa raw pwedeng isama per DBM dahil hindi pa siya open? Hindi pa siya na-create. It can only be created once the 3 billion will be... Yung sa 7,000 transfer, yung sa 3 billion, 7,438, hindi pa. Kasi idadagdag, hindi pa.
Yung for creation, hindi pa nakikreate.
Yeah,
Ito
yeah.
na-create, hindi pa na-fill.
Yes. So the 7,438 positions has not been created yet. It will be created once the 2016 budget will be approved. So 7,438 plus 53,347, the moving number, the running total would be 60,785 personnel. Parang gumagalaw po yun. Just like in 2015, nung pag-start, hindi raw 53,347. But when the positions were already created, it already became 53,347. So there's still 20,000 plus that will be filled up. Yung 20,000 plus na yun, kasama yung 12,425 plantilla positions in hospitals and TRCs and regional offices. Kinuha siya sa MPBF. So for 2016, wala nang MPBF. Andi dito na siya lahat.
MPBF, yung Miscellaneous Personal and Benefits Fund.
Yes.
Wala na doon sa...
DBM.
Hindi, anong provision yun doon sa...
Sa DBM.
Special... wala na siya sa Special Purpose Funds.
Wala na, Your Honor.
Anong rason bakit linipat? Anong rason? Dapat may rason. This
Your Honor, because there were a lot of questions and allegations against DBM na lump sum daw siya. So para to end all the haka-haka, klinaro na kung itong MPBF, saan bang mga departamento na pupunta?
dinisaggregate.
Dinisaggregate and it was lodged in all the departments.
Okay. Dahil sa perceived evil na lump sum funds.
Yes. So the 4.3 billion out of the 7.763 is the MPBF.
Okay, slowly it's coming. Because you know, when we go to the floor of the plenary, they're going to ask me that, and I have to be able to answer that. Okay. So that takes care of the 4 billion.
4.3, Your Honor.
4.3. So you have a residual of 3 something.
The 3 billion is for the 7,438 new positions to be created in 2016. And there's 100...
Plantilla positions.
Plantilla positions.
And you're saying that these plantilla positions will be approved as plantilla positions when the budget is approved.
Yes, Your Honor, it will be created by DBM. Then 198 million there is for the retirement, payment of retirement, and then 187 million for the terminal leave. Yung salary increase based on the salary standardization law is incorporated in the 4.3 billion.
May kasamang salary increase na doon.
Yes, yung sa MPBF na inilipat, kasama na doon yung salary standardization, the increase.
Nasa MPB.
Nasa
Wala pang batas.
Your Honor, allow me to just align my statement. The MPBF, parang dinisaggregate, inattribute na nasa department ng 4.3 billion. This is for the new positions created in 2015. But for the salary increase, it's still in MPBF, pero naiwan sa DBM.
The salary increase.
Yes, Your Honor. Because I think they're waiting for the law.
Oo nga, yun ang pinagtatakong ba't may SSL4 na.
Yeah, ando din na, nakaabang na siya. We're just waiting for the law. Kaya hindi siya mailagay sa DOH.
Okay. Hearing suspended for a minute. Okay, hearing resumed. Madam Secretary, your people behind you, I'm sure they're very capable, no? I need an apples to apples 24 kasi ang daming rason. Isipin mo naman, from 142 million, nagiging 7.3 billion. Pagdating sa plenary, ako po yung sasagot niyan eh. Kailangan maintindihan natin Tapos itong ngayon, sinasabi nyo na yung galing sa Special Purpose Fund, yung Miscellaneous Personal Benefits Fund, linipat dito kaya lumubo. Tapos sinasabi nyo merong increase. Can we have a detailed, I don't think, let's not do it now, no, but really, we have to be able to answer this later on. So we need an apples to apples later on, 2014 versus 2015 and 2016. And then so miscellaneous personal benefits, how much was transferred. But we can have a whole picture, because clearly what is seen here does not even tell us complete story. It raises more questions than answers, no?
Yes, Your Honor. We will submit a point-by-point explanation of the increase of 7.7 within the week.
And apples to apples in
Yes.
every year. Okay, so
Yes, Your Honor.
sige. Can we have a restatement, no, of everything? Yes, Your Honor. Session suspended. Hearing suspended for a minute. Okay, hearing resumed. I'll just await that explanation. Another point is that nagdagdag po kayo ng tao ng 7,000 this year for 2016, correct?
Yes, Your Honor, 7,438.
Okay. Yung dagdag na ito was necessitated by?
It's the staffing pattern, Your Honor. The required staffing pattern of all DOH hospitals, DOH retained hospitals.
Okay, DOH hospitals. And who gave you the I suppose those that gave you the staffing requirements were the hospitals themselves.
But it was, yeah, it was there's a DBM circular that served as a cover, but the HR department in the central office checked and coordinated with the individual hospital. So you take into consideration the bed capacity, the services being offered, the
In other
staffing
words,
standards.
you're following
The staffing standards. We're following a staffing standard that for this, if you have this number of patients, this should be your personnel complement.
So there's a formula of some sort.
Yes,
Number
including
of beds
specific
is equal to
positions.
number of doctors, something like that.
Yes, including specific positions and specific services.
I see, I see. Which goes to my idea of, is this going to be sustainable? If it's going to be based on a bed ratio and we keep increasing and increasing as population increases, can the national government sustain this? Really, I was thinking that's why it goes back to my idea of DOH letting go of all its hospitals and services and just be a standards setting for services, for institutions. But anyway, that is my concern. Looking down the road, can we sustain this?
Yes, yes, Your Honor, it's sustainable because the projection, the staffing standards that was considered was actually closing in on the gap. And
Closing in on the top,
the gap.
the gap.
Gap.
Okay.
What we have now is a hospital mapping system, is the existence of both government and private hospitals. So, for example, for this government hospital who intends to increase, let's say, increase in bed capacity from 200 to 400 beds, meron na pong ginagawang hospital mapping na kung meron namang private hospital sa palibot or other LGU hospitals, it will not be allowed to increase. So this data will also be given to Congress and Senate so that proposed legislative measures insofar as increasing bed capacity is concerned, we will not recommend it. So meron ng areas na recommended kung saan siya mag-i-increase. In other words, this will not mean that in the succeeding years, meron ulit dagdag na employees. Kasi the staffing standards that was considered took into consideration the whole picture already. With this actual filling up from Trans 1 to Trans 4, and with PhilHealth programs, our expectations is that in the next probably 5 years now, next 5 to 10 years, wala na po siyang increase. Replacement na lang. And for, let's say, kung merong mga emerging diseases or let's say calamities that warrants additional employees, kayang-kaya na siya ng MOE that will be provided by PhilHealth reimbursement.
So in the next 5 years, wala nang increase, ha? Ang projection niyo?
Yes, Your Honor.
Okay.
Ito po, Your Honor, yung kunyari merong, yung mga hospitals na sinasabi nila na punong-puno ng pasyente, kulang na kulang ng mga health workers, lahat po yun kinonsider na.
I
Up to
see.
level. Inubos talaga yung assessment. So that's why it's 4 tranches.
At mabuti meron kayong hospital mapping. So pati yung private na include doon.
Yes,
So as to avoid overcapacity of beds.
Yes, so para kunyari, may magre-request dito ng legislation, increase in bed capacity to this much. The
You just look at the map now.
Yeah, the director will advise that it's not really needed kasi yung population dyan, ito yung database dyan, the data that will be coming from the public health associates.
Okay. That's the way it should have been.
Yeah. In other words, Your Honor, just to give a bigger picture, the total staffing standards approved for all DOH hospitals was 49,952. Binawas natin dun yung existing position, so 49,952 less existing positions of 13,850. There was actually a gap of 36,098 positions. That was addressed by Trans 1, Trans 2, Trans 3, and we're now on the last Trans 4. That will cover for the 36,098 needed staff, needed personnel after evaluation of all hospitals, including TRCs.
Okay, Madam Secretary, after this hearing within the week, could you favor me with a written summary of what you just said? Kasi wala naman dito sa NEP yung kwento mo. Pero pag may nagtanong sa atin sa plenary, masasagot naman natin ng maganda.
Yes, Your Honor.
Thank you. Let's move on. HFEP. Napansin ko po dito sa HFEP, unang just glancing at the very thick listing of HFEPs, I noticed that the amounts are uniform. For BHS, for example, dito lang sa first page, no? Nakalagay dito. Barangay health stations, halos lahat, 1.5 for infrastructure. Itong 1.5 million for infrastructure. Maraming pare-pareho mga So, how did you come about at these amounts na pare-pareho po? I'm just curious how we came about with very uniform amounts.
Your Honor, we actually came up with a per square meter costing. Kung magkano yung check-up area, magkano yung maternity care package, and the TB dots. For the barangay health facilities, that's actually the amount needed for the specific areas identified to be converted into a BHS birthing clinic. So that's why it's uniform, because there's already an existing barangay health station. That amount will cover its expansion, infrastructure-wise, for it to be converted from a BHS non-birthing clinic to a BHS birthing station.
How would you deal with overruns then, because of the peculiarities of the situation? If a particular BHS is situated on a slope, then the cost would be different.
Yes, Your Honor.
If there is need of filling landfill, then the cost would be different. I understand the per square meter basis, but how would you deal with the actual deviations?
There's an allowance of 10% of the project cost. Per Architect Peñafiel, there's an allowance of 10%. But Your Honor, because it's quite voluminous, we actually requested for validation. So apologies for that, but we actually have an errata for submission for the actual cost.
There is a validation.
Yes, Your Honor.
Okay, who did the validation?
The regional offices.
Okay.
Kasi yung iba, tama naman yung computation. It includes the validation of personnel and the ownership of the land. If I may, Your Honor, we can give you a matrix of the minimum personnel required and then the minimum lot area required. So usually they will say meron, pero pag hinanapan na ng papeles, yung pala hindi pa na-donate or hindi pa na-transfer. So yun yung mga parameters na ni-require, including the personnel, Your Honor, because the LGUs should have a complement personnel aside from the...
Malaking problema ba yan, yung ownership ng land nangyayari ngayon? Kasi tama yun, di ba? You cannot build it on private land. But marami bang problema gano'n na yung pala pagtingin nila walang titulo pala, walang whatever.
Meron siya, Your Honor, hindi ganun karami. Probably around 8%. Around 8%.
Around
Ang mas
8%.
malaking problema actually are the personnel. Because sometimes they would assure, like the LGU would commit.
Yes, how do you deal with that? Because look, in your... Sandali, let me... Saan ba yung figure na yun? I wrote it down somewhere. You will upgrade 4,500 barangay health stations. Okay, 4,500. And then, health stations in 3,200 elementary schools. In elementary schools, 3,200. And then in barangay health stations, bukod dun sa schools, 4,500. That gives you around almost 9,000. It's actually 8,700. Sabihin ko na 9,000. 9,000 barangay health stations. Kaya ba yan ng tao? Baka mo nun, mamaya, panay edifice na lang, tapos walang tao. Paano po yun? And we know that DOH is not in charge of the... Is DOH in charge of the personnel for this?
No, Your Honor, we're not.
It's the LGU, am I correct?
Yes, Your Honor. That's why, Your Honor, there was a validation that was conducted. For the 3,886 birthing BHS, that will actually be mine. If you will look at our human resource deployment, we have 3,100 midwives. Yan po yung kulang. Kasi yung iba meron yung LGU, yung sa DOH is just augmentation. For the school-based, the actually school-based clinic, it will be manned by our nurses. That also, dyan po pumapasok yung ating nurses, the additional NDPs.
So these nurses now are hired by the Department of Health.
Yes, Your Honor, for the school-based clinics.
Which is around 3,200.
Yes, Your Honor.
So you will have 3,200 clinics
Inside
and you
the
will
schools.
hire inside the schools and you will hire 3,200 nurses.
Yes, it's a joint DOH and DILG program. The rationale of this, Your Honor, is that some of the barangays still does not have a barangay health station for lack of land. Second, Your Honor, if there's an available land, usually malayo siya, medyo liblib. Not only is it unsafe for the community to go there, lalo na pagka hindi masyadong matao, we also realize that the focus of the community is really on the school area. So if it's in the school, we will be able to address the sharing of knowledge from our nurse to the teachers. Kasi kahit pa paano, nalalaman nila, natututunan nila ano ba talaga yung mga first aid, the signs to watch out for, when to refer, when not to refer. And the Department of Education, with the RAP plan, natanggalan po sila ng nurses. So, if we put the clinic there, the parents picking up their kids, can actually have themselves checked and have their younger siblings immunized, as well as the nutrition program, doon na rin po, doon na rin yung immunization, doon na rin yung ibang mga basic care. It will be more or less tasked with the promotive and preventive aspect of healthcare, not the curative one.
So yung health stations na ito sa loob ng eskwelahan, the community will also access this.
Yes. But
So
basically,
there's no exclusivity for the school only.
No, Your Honor.
Okay.
So, yung mga kapatid ng estudyante, yung nanay, yung tatay habang naghihintay. And we also noticed, like example for, let's say example, asthma. Many of the people in the barangay cannot afford a nebulizer. Kasi hindi naman sila palagi nagkaka-asthma. Sometimes they would have an allergy. So if it's school-based, pagdating nila sa umaga before going to school, then they can have an inhalation, lunch break, another dose, then before going home, mafu-fulfill na nila yung tatlo before they go home. So there's compliance there. Moreover, Your Honor, in a school, palagi siyang may tao, so yung mga gamit hindi mawawala. It brings the health station closer to the community, while at the same time allowing the exchange of information between the medical workforce and the teachers and even the parents. So the costing for that, Your Honor, is actually 1.5 all in.
Okay. How about the others outside the school? Itong 4,500 barangay health station. How will you assure that the local government will provide?
These are all existing, Your Honor, but unfinished. Kasi nanghihinayang kami when we had an inventory, these facilities are all existing.
These are not to be built. Need to be built. These
To
are
be finished. They are existing, but they are not PhilHealth accredited. Because they lack this aspect, wala silang
for several reasons. Yeah, ang dami kong nakita yung ganyan pag-ikot ko. Ang daming
Yes.
ganyan.
Ang karamihan doon is yung area for yung birthing room, and then even the equipments. In other words, that allocation will pave way for the PhilHealth accreditation of these
see.
facilities.
That's why there's also /upgrade. Yung pala, most of it is upgrade.
Yes. But for upgrading, Your Honor, we already came up with guidelines that upgrading will be limited to accomplish PhilHealth accreditation. Hindi na yung upgrading na depende sa design na recommended ng LGU, because sometimes it becomes very expensive kung marami kang parameters na ipapasok.
Yes. That's a rational way. Upgrading in terms of compliance so that you can be PhilHealth
standards.
accredited. Yes.
That's why if, let's say, the request was, let's say, 3 million, we just approve 1.05 kasi yan lang yung kailangan for PhilHealth accreditation.
Okay. So wala na tayong bagong, aside, ilabas muna natin yung elementary schools, no? Aside from the elementary schools, wala nang bagong BHS.
Wala, Your Honor.
Upgrading lang lahat.
Yeah. Ang magkakaroon lang ng bago are the RHUs.
RHUs,
Yes.
which is a different category altogether, no?
Yes. And the purpose
Am I
of
correct?
this...
RHUs are based in the municipalities, yes?
Yes, Your Honor. Yeah. In other words, the BHS will be handling preventive and promotive care, including advocacies doon. The RHUs naman will be the line 1, the first line of defense for those who are sick. So, meron siyang konting preventive and promotive, but more on the curative side for the basic diseases. And once needing admission, na medyo a little bit complicated, we now bring them to the level 1 hospital. So in the upgrading of hospitals, nakasaad po doon, yung upgrading in terms of infrastructure and equipments will also be based on PhilHealth accreditation. What does this hospital need to be elevated from an infirmary to a level 1? So tinitingnan na rin namin, may personnel ba sila? Kung mayroong personnel, we approve it. Kung walang personnel, naka-hold muna. So from level 1 to level 2, ano rin yung parameters, level 2 to level 3, ano yung needs. That is what's being funded by HFEP.
Tsaka yun nga, no, yung level, you changed the standards in 2013. Am I correct?
Your Honor, there was an order issued by Secretary Ona. And it's really good. The intention is really good. Unfortunately, it's not doable in many aspects. So we already issued the new guidelines.
So you've changed the ones that were issued in 2014. You've changed.
Yes, Your Honor. I've signed a new amendment to that, I think a month ago.
Can we have a copy of the one that was issued by Secretary Oma and the one that you just signed a month ago?
Yes, Your Honor.
Thank you.
Yes, Your Honor.
So I take it to mean that whatever, what shall we call it, what the term is, not doables have been taken away
Yes, Your
from the
Honor.
standards.
Especially on the issues on manpower.
Okay.
So, tinangina po natin doon yung HFEP at then yung hospital classification. Because like for example, in a basic laboratory, the minimum requirement for the number of medical technologies is 15. But if you total the number of hospitals times the expected number of medical technologies and you compare it to the population of medtechs that we have in the Philippines, hindi po talaga doable. And the hospital will not earn, especially the private ones. And the LGUs will have a hard time coping up. Kasi kung meron kang infirmary, magkakaroon ka ng 15 medtechs. I'm actually a medical technologist. So, alam kong, kasi karamihan ng medtech, they go into medicine. So, you have to factor that in. So, we reduce it. Tsaka pag gabi, ang medtech kasi you do laboratory work early in the morning. Usually, afternoon and evening, yung mga stop na lang yun, yung mga urgent. So, we reduce that. And then there's also the practicality na in some areas, dental requirements, we also deleted that except for level 3 hospitals. Because like for an infirmary, for a level 1 hospital, na hindi mo siya mabibigyan ng license kasi wala siyang dental requirements, eh baka naman walang dentist sa area. That's why, in addition to that, Your Honor, we even took out the dental requirements in the RHU. Kasi that was one of the bottlenecks for PhilHealth accreditation. We took it out, but in its place, we allocated a budget for mobile dental that will be handled by the province. It will be coming from DOH, yung mga gamit. The dentist will also be DOH, but the operations will be that of the province para umiikot-ikot na lang siya. That will actually close the gap in terms of dentist to municipality ratio. But we made it mandatory, I think, for level 3 hospitals. In some areas, lalo na yung mga medyo liblib na lugar, tinanggal po namin yung mandatory for residency training. Tama ba? Wala si Ruben. We made it at least 2. Because it will also be difficult for these hospitals, especially in the provinces and in the GIDA area. So, ang apekto po kasi nun, Your Honor, pagka na-downgrade sila, pati yung PhilHealth benefits downgraded, then yung PF downgraded din. And we also made a delineation between the standards of licensing of government hospitals as compared to private hospitals kasi magkaiba po ang structure sa loob in terms of management. So, basically, we underwent consultation with the Philippine Hospital Association, including the private hospitals. I created a team, a technical working group to handle this Luzon, Visayas, and Mindanao, and that's the output that we have now.
Okay, sige, that's clear. But could you give me what the documents I asked for, including an explanation of what you just narrated, so that we can understand the whole story?
Yung isa pala, Your Honor, yung sa birthing clinics, and even we made it not retrospective but prospective. Kasi ang naging bottleneck doon yung size. Example, this is already an existing, because I think that was the question being forwarded to me earlier, na bakit na downgrade, bakit hindi ma-issuehan ng license. We already amended that because that's part of the hospital classification. Hindi mahirap po kasing bakbakin kasi na-construct na siya. Now, the new guidelines in 2013 called for an increase, let's say increase in rooms, increase in space. Existing na yun eh. So, the new guidelines will only be applicable for prospective maternity clinics. So, it's already in the amendment. Yung lahat po na existing, marirenew na yung license nila.
Okay. Yun nga, no, pagdating sa HFEP, you have upgrades, no? 4,500. That's a lot, huh? And you're saying that this is to complete them with the end in view of having them accredited with PhilHealth. 4,500 all over the country. That's a lot. Pwede ba, Secretary, na itigil na natin yung yung incremental building through increments of RHU, whatever health facilities. So if it's a barangay health station, let's allocate funds and build it and then kompleto na siya. Hindi pwede yung by phases na kulang pa yung kwarto para sa laboratory, kulang pa yung... Sa pag-iikot ko, ang dami kong nakitang ganun eh. Pwede ba natin itigil na yan?
We do agree, Your Honor. In fact, even for the hospitals, now for the LGU hospitals, and even for the DH hospitals, we have now become we are now firm with our guidelines. That if let's say 50 million is allocated, it should be a usable building. Hindi pwede yung if you have 200 million pero hiniwalay-hiwalay mong tatlong maliliit tapos hindi functional. All of that has been. We are going to consider that, Your Honor, and we do agree with you.
So can we have that a written policy sa HFEP na wala ng incremental building or building by installment? Sampung, for example, like you said, sampung building, tapos lahat, foundation lahat. Paano magamit yan ng tao? Dapat, one building lang, kompleto na lahat. Para pagtapos, PhilHealth accredited pa, magamit na kagad ng tao.
Yes, Your Honor. Actually, our attention was also called by the Commission on Audit in that. So, with your suggestion, Your Honor, USEC Lilibeth will incorporate it into the proposed policies that will be approved by EXECOM.
How about the use of batch contracting? Instead of one contractor for every BHS in one area without a batch, so that the contractor can take advantage of the economies of scale and thereby lower the prices, thereby lowering the building, thereby having savings for the national government. This is actually a recommendation of one of the papers that I've read.
Yeah.
Maybe Yusek Gako can,
he's
I see him
actually
whispering
affirming.
something.
Yeah, Yusek Gako is giving us, we actually explored, Your Honor, the costing. Mas cheaper po talaga pag...
These recommendations come from a paper written by PIDS, Philippine Institute of Development Studies. They studied HFEP and this is one of the recommendations. Ganun naman talaga, the same thing. That's the same philosophy dun sa purchase ng medicines ng DOH, di ba? Because of the economies of scale, you can bring it down. So can that be can we do that also sa HFEP?
Yes, Your Honor. In fact, Yusek Gako was making a computation. Kunyari yung sa school-based clinic, we're computing it na kung individual ang implementation, masyadong mahal. But then recently, the costing has been, they tested it in the market for an ABC of 1.5. The lowest that agreed parang was something about 1.3. 1.35 or 1.3.
Okay.
And that's all in.
So can we have...
Doable na siya.
Can we
Usable na agad.
Yes. So can we have a list of rules or policies for HFEP issued by the DOH incorporating those things like no building by increments or by installments, where practicable, batch approach when it comes to contracting?
Yes, Your Honor. We welcome that and we do agree. Thank you for all the inputs. Because now I'm getting feedback from our EXECOM members na dapat na talaga lagyan ng guidelines yung HFEP utilization and it should be used for direct patient care. Kasi minsan nagagamit siya for things that are not direct patient care.
And then, yung coordination, tsaka monitoring, paano yun? Yung monitoring.
Your Honor, for HFEP implementation now, all the regional directors will be and have been informed as to the beneficiaries plus the exact amount. So in terms of implementation, most of them will be bidded at the regional and at the local level, including supervision. We have also augmented their manpower, including engineers and architects. So merong accountability sa baba. Then the central office will be more on supervision.
And coordination. Are the regional directors are here?
Yes, Your Honor.
Yeah, pag-ikot ko, umiikot ako sa mga munisipyo, sa probinsya, pupunta sa akin yung 3 beses yata nangyari na yung sa akin, pupunta yung mga mayors, nagko-complain, tapos dadalhin pa ako sa RHU, tignan mo, senator, hindi pa tapos, ganito. Basta non-stop, you know what I mean, di ba? And masama ang loob nila, so nakikita ko, bukang kailangan mga regional directors, kailangan ng communication with the mayors. Not just the congressmen, but the mayors. Lalo na yung mayors kasi nakasituate yung BH, Barangay Health Station or RHU, whatever, in their municipalities. And they have to be apprised if there is a delay, why is there a delay, so that they know what's happening. Para sa ganun, hindi na kailangan humila ng senador sa lugar at ipakita pa bakit may delays.
Yeah. Apologies for that, Your Honor, but yes, the regional directors have been directed to go around. Inuna lang po namin yung RHUs and urban health centers. So all of the RHUs and the urban health centers will be PhilHealth accredited by end of June next year. Lahat po ng mga kulang, kasama po yun. It's actually included in the proposed GA for 2016.
Did you say, ma'am, that all RHUs will be accredited?
Kasi with the total RHUs that we have, only 5% are accredited for
PhilHealth?
For the 3 packages.
Per package nga naman, ano?
Yung 3-in-1, Your Honor. So we'll make it maternal and child care, MCP accredited for the checkup, and the TB dots. Yung iba maliliit lang actually yung kulang eh. That's why pupunuin po siya para lahat. And that will actually decongest our hospitals.
Okay. And then lastly, meron ba tayong service, sinatawag natin service delivery network plan for the HFEP?
Yes, Your Honor. It's coincided with the mapping. That's why for the other
Yes, the mapping would be essential for that,
yes.
correct?
Yung maraming humihingi ng mga dialysis machines, ang sinasabi namin, it's difficult for you to maintain kasi ito lang yung ibang humihingi sila ng MRI na malalaki. Then we bring them down and say, ito yung mas needs nyo. You need an ICU, you need a laboratory. The identification is there. So the regional directors have already come up with a needs list so that the wish list, once it goes to them, will be validated. And there's an existing needs list that is constantly being upgraded and amended.
What entity in your department, Secretary, is in charge of that?
The Office of Director Chris Abesamis. It's called Health Facilities Development Bureau, HFDP.
Health Facilities Development Bureau. Dr.
Chris
Abisamis. Okay.
Working in tandem with health operations, headed by Asek Santiago. They're both single. And tatlo pala, sir, kinuha na namin, sinama na namin yung HR so that whenever there's a problem, the HR head, Dr. Ken Ronquillo, can explain to the LGU na kung gusto nyo ng ganito, let's say you need a CT scan, ito po yung personal requirement, ito yung manpower requirement. So naging tatlo po yan, operations, HR, and the office. And Dr. Ken was also single.
You know, kidding aside, that's very true, huh? Like when I go around, nako, their pet request is always dialysis machine, the LGUs, and mahirap talaga.
It's actually not easy to maintain and to sustain.
I know.
Yung infection rate, then
I
the
know.
water quality.
Yes.
Yeah. So they explain it to them. And then we give an option. Linalabas na ng RD. Ito po yung needs list. Like these are the needs of your hospital to be upgraded into a level 2.
Correct.
Kasi level 1 pa lang.
Okay. Sige. So, hearing suspended for a minute. Okay, hearing resumed. Secretary Garin, ma'am, in the course of the hearings, we asked for some data from you, some explanatory letters. Can we have all that before the plenary? Otherwise, di ko isasalang to sa plenary. Ako mag-explain.
Yes, Your Honor. We will be submitting within the week the explanation as to the 7 billion plus increase in personnel allocation. We will also be giving you a proposed HFEP guidelines, and then the other one is the amendment to the licensing requirements in terms of implementation that we have.
Okay, lastly, before we break up, nag-Uber ka ba, Secretary Garin?
No, Your Honor.
Do you know how it works?
No, not really, Your Honor.
But basically, it's a service. It's a service that is provided whenever you need it. But instead of owning a car that you have to maintain yourself, someone else maintains it, and you just pay that person when you need it. It's a taxi, basically, no? What about the idea? Because I keep seeing endless requests of LGUs for ambulance, no? Where possible, would it be, especially Metro Manila, where you have densities of population and densities of hospitals requiring ambulances, would it be a better idea to have service providers for ambulances so that when the hospital needs an ambulance, they just call the service provider and get the service provider sends the ambulance, picks up the patient, delivers the patient to wherever, and the hospital pays. Or the LGU pays. No need anymore for maintenance because the service provider maintains the vehicles. No need anymore for a driver, plantilla. So the LGUs and the government agencies and hospitals save on that aspect. What do you think of that idea, Secretary Garin?
Your Honor, that's a very good idea, actually, pooling the ambulance requirements, because it can even cater to both government and private patients.
Yes, definitely.
And you're right, Your Honor, because many of our hospitals are having a problem. Kasi kunyari, may ambulance siya, masiraan ng gulong, maghihintay ka pa, you have to purchase. Well, if it's a pool, kung yung isa medyo sira yung gulong, pwede mong ikunin at ilagay muna sa kabilang ambulance. And the drivers is also a problem. Kasi syempre, as we age, we become more mature in terms of institutional memory. Pero some reflexes are also lost. So an ambulance driver requires a younger age. So meron pong ibang facilities na, because they're there as a permanent capacity, mahirap nang i-replace. Hindi ka makahanap ng bagong driver because somebody is still occupying the position. But the greatest nightmare that we actually have is the maintenance. Kasi hindi mo magamit na yung part sa iba and then it's a procurement mechanism so tatagal siya. That's a very good idea, Your Honor, and we'll talk with ASEC Bayugo. ASEC Bayugo is actually, he's in charge of our PPP office and we can have that as a PPP proposal. The government can actually pay a minimum amount, parang consumable rate siya. Tapos pag private ang gagamit, pwede rin. Ito yung government consumable rate. And that's that it can be actually, it's doable, Your Honor.
So, sige, we can explore that in future hearings or meetings. I have no other concerns. So, with that, the Secretary, yung mga information natin, with that, the budget of the Department of Health and its attached agencies is hereby approved. Thank you very much.
Thank you, Your Honor.